everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what is bipolar I disorder? Ooh, Okay, let's get into what bipolar I disorder is. Before I do, I just have a few things I need to say. The first of which is that this is not the diagnostic criteria for bipolar I disorder. This is just a description of what's going on, but it's not meant to be used to diagnose anybody, and you'd have to see a licensed professional in order to do that anyway, so I'd recommend that if you're looking for a diagnosis. Also, this is just a description. If the label of bipolar I disorder bothers you, if it makes you stressed out, if it hurts you in any way, if it doesn't help you to heal, you don't have to use the label of bipolar I disorder. You can just let go of the label. Really, it's just to point you towards something that may be going on in your life or the life of someone that you loved. So that out of the way, let's get into what bipolar I disorder is. I have an extensive amount of notes down here that I'm going to be reading from just to make sure I get everything correct here, so please forgive me. But let's get into what bipolar I disorder is. So it's also sometimes abbreviated as BP. And it features manic, hypomanic, and major depressive episodes, and I'm going to get into what those are. But for a bipolar I diagnosis, there has to be at least one manic episode in the lifetime of the person. So what is a manic episode? A manic episode is a persistently and abnormally irritable, expansive, or elevated mood with increased energy or goal-directed activity. It's something that lasts at least 1 week, nearly every day for most of the day, and 3 of these must be present, 4 if the mood is only irritable. So if you're only irritable, you have to have 4 of these. If you have an elevated or expansive mood, then only 3 are needed. So these are the things: grandiosity or inflated self-esteem, diminished need for sleep, feeling rested after only a couple hours of sleep, for example, pressure to keep talking or more talkative than usual, feeling that your thoughts are racing, or there's what's called like a flight of ideas, easily distracted, or and that's something that can be reported by other people, increased goal-directed activity or purposeless activities such as being fidgety, and increased activities that have high potential for poor consequences, things like sexual promiscuity, poor spending, going on spending sprees, any of that kind of stuff. So 3 of those needed, 4 of them if you're in an irritable mood. It's got to be something that impairs your everyday life, or it could be something that requires hospitalization or features psychotic features, and it's not due to a substance or a medical condition. If this manic episode happens during antidepressant treatment, however, and it lasts beyond the effects of what the treatment would be expected to normally treat, then that is sufficient enough to qualify it as a manic episode. So that's a manic episode. There's one of those needs to be required, at least one of those in your life, to have a bipolar I disorder diagnosis. There's also hypomanic episodes, which are not required, but they're common, and that is similar to a manic episode, except for instead of lasting an entire week, it could only be 4 consecutive days up to a week. And a hypomanic episode does not have to, it's not significant enough to interfere with your everyday life, require hospitalization, or have psychotic features. It is a change in function from when you are normal, when you're normally asymptomatic, and it's something that's observable by other people. You also have major depressive episodes, which again are not necessary for the diagnosis, but they will occur. And you have, so what is a major depressive episode, also abbreviated as an MDE? It is something that during a 2-week period you either have a depressed mood or a diminished interest in pleasure in most activities. It's something that happens most of the day, nearly every day, and it's something that can be described by yourself or observed by other people. So for a depressive episode, you have to have most of these. Significant change in appetite or weight. In children, there could be a failure to make age-appropriate weight gain, insomnia or hypersomnia every day, excessive activity or slowed activity, so fidgeting, pulling at clothes, slowed speech, slowed reactions must be observable by other people, fatigue or loss of energy nearly every day, excessive or inappropriate guilt, possibly delusional guilt, and feelings of worthlessness nearly every day. Diminished ability to concentrate, having indecisiveness nearly every day can be observed by yourself or by other people. Recurring thoughts about death, suicidal ideation without a specific plan, or a suicide attempt. All of this has to cause a significant disturbance to your everyday functioning, and it's not due to a substance or a medical condition. Now, a regular response to loss, such as grief, may or may not constitute a major depressive episode, but you want to distinguish this from what would be considered normal grieving. So I'll just quickly list off the difference between normal grieving and what a major depressive episode is. So during grief, you have feelings of emptiness and loss. During depression, you have a depressed mood and an inability to experience pleasure. During grief, it comes in waves, while depression is more persistent. Grief may feature happy and positive moods in between. Depression features self-criticism and rumination. Grief has your self-esteem remains intact during grief, and if there are self-derogatory feelings, they're usually because of a perceived failing about whatever the loss was. And when it comes to depression, the feelings of self-loathing and worthlessness are just there. When it comes to grief, thoughts about death are linked to the loss. And when it comes to depression, thoughts about death are linked to feeling worthless, unable to bear the pain, and undeserving of life. So that is a major depressive episode. Again, it's not necessarily for a bipolar I diagnosis. What is necessary is having at least one manic episode in your lifetime. Now, all of these things cannot be better explained by schizoaffective disorder, schizophrenia, schizophreniform disorder, delusional disorder, or other specified and unspecified schizophrenia spectrum, and other psychotic disorders. There are a number of specifiers to clarify what's going on when we talk about bipolar I disorder, so I'm going to go over those quickly here. You can have mild, moderate, or severe, which really just comes down to the number of symptoms that you're having of all those things I listed. It could be in partial remission, which means that there's been a period of less than 2 months where no symptoms were present, or a period where full criteria were not met. Or it could be in full remission, which means in the past 2 months no symptoms were present. You could have what's called with anxious distress, and to have that you have to have at least 2 of these. So tense feelings, restless feelings, trouble concentrating because of worry, or fear that something awful is going to happen, or feeling you might lose control of yourself. And if you have with anxious features with anxious distress, that indicates a longer duration of your symptoms, a higher suicide risk, and a greater likelihood of treatment non-response, unfortunately. So it's important to note if you have with anxious distress. With mixed features is another specifier. So to have a with mixed features specifier, it could happen during a manic or hypomanic episode or a major depressive episode. So when it comes during a manic or hypomanic episode, you have to have at least 3 of these. And that is depressed mood or dysphoria. That can be something that's reported by other people. Diminished pleasure in interest in most or all activities. That's also something that could be reported by other people. Slowed physical movement, that is something that must be observable by other people. Loss of energy or fatigue, inappropriate guilt or feelings of worthlessness, recurrent thoughts of death, suicidal ideation without a plan or a suicide attempt or a specific plan for committing suicide. So any of 3 of those during a manic or hypomanic episode. Also possible for with mixed features could be during a major depressive episode, you have at least 3 of these. So expansive elevated mood, grandiosity or inflated self-esteem, pressure to keep talking, more talkative than usual, racing thoughts and flights of ideas, increase in goal-directed activity and energy, increased involvement in activities that have a high potential for painful consequences, such as overspending, poor investments, or sexual promiscuity, decreased need for sleep, feeling rested despite having less sleep. So any 3 of those with mixed features has to be observable by others and has to be a change from your usual behavior. And if the symptoms meet the with mixed features for major depressive episodes and a manic episode at the same time, then you would use the specifier mania with mixed features. You wouldn't use the major depressive. And all of this, when we're talking about mixed features, can't be due to something that's happening during the use of a substance. There's also a specifier of with melancholic features, which has the following. So you have to have at least one during the most severe period of your depressive episode, which would be loss of pleasure in almost all activities, or no reaction to things that are usually pleasurable. And then in addition to that, you have to have at least 3 of these. Profound despair, moroseness, or despondency caused by depressed mood, so that's 1. Depression is worse in the morning. Waking at least 2 hours before the usual awakening time. Excessive activity or slowed activity. Significant weight loss or anorexia. And inappropriate or excessive guilt. So any 3 of those. And when you have with melancholic features, it is more likely to occur in a mild depression and in a depression with psychotic features. You also have the specifier of with rapid cycling. So with rapid cycling, there is at least 4 manic, hypomanic, or major depressive episodes within the previous 12 months. The episodes must be separated by partial or full remission or switch to the opposite polarity. So manic and hypomanic episodes are on one polarity and major depressive episode is the other. So it has to be switched between the two or separated by partial or full remission. And these episodes cannot be caused by a substance or medical condition. So those 3 things add up to rapid cycling. You also have with atypical features, and that is something that occurs during a major depressive episode, and it doesn't mean that it's uncommon or unusual. It's just the word that they use, atypical. So what happens is you have a mood reactivity, your mood brightens, and you have 2 or more of the following: significant increase in appetite or weight, hypersomnia, leaden paralysis, which is having like a heavy feeling limbs, long pattern of rejection sensitivity that limits your functioning, which would be a trait. And when you have with atypical features, it can't be with melancholic features or with catatonia. So we also have with psychotic features, which is when there are delusions or hallucinations present. So you have with mood congruent psychotic features, which is when the content of delusions and or hallucinations are consistent with depressive themes like nihilism, disease, death, personal inadequacy, guilt, or deserved punishment. And you also have with mood incongruent psychotic features, which is when the contents of your delusions and or hallucinations do not involve those themes, or they involve a mixture of mood congruent and mood incongruent themes. You also have with catatonia, which features catatonia. I have a video on that if you want to check out what that is. There's also with peripartum onset, which is when symptoms occur during pregnancy for the first 4 weeks following delivery. 3 to 6% of pregnant women will experience this. 50% of instances begin prior to the delivery of the baby, and it can feature psychotic episodes, which may lead to infanticide, so it's something to take seriously. There's also a with seasonal pattern specifier, which is when the major time relationship between the onset of these episodes, there is a major time relationship, so for the fall or the winter, for example, and it does not include when there are regular seasonal stressors. So if you have a seasonal job, that would not be an indication that there's a seasonal pattern. It has to do with specifically with your disorder. With seasonal pattern also, there's a full remission that occurs during a characteristic time of the year. For example, clears up in the spring. It is something that's happened in the last 2 years with no non-seasonal depressive episodes occurring. Or manic episodes occurring. The seasonal episodes are greatly outnumbered by non-seasonal episodes during the person's lifetime. The seasonal episodes greatly outnumber the non-seasonal episodes during one person's lifetime. Higher latitudes and younger age have a higher risk for recurring winter episodes. So I'm trying to wrap this video up quick, guys. I'm sorry it's taking so long. It's just a complicated disorder, bipolar 1. Treatment. Cognitive behavioral therapy, psychodynamic therapy, family therapy, medication. Medication is very much recommended when it comes to bipolar 1 disorder. Of course, you'd want to see a psychiatrist for that and a therapist to put together a plan that's individual for you. I made special note here that you want to take special care when diagnosing children, so obviously you want to see somebody for that, but just take special care because children go through normal developmental stages that may appear like bipolar 1. In bipolar 1, people who have bipolar 1 disorder, their suicide risk is 15 times more likely than the normal population, and it's maybe accountable for as high as 1/4 of all completed suicides. So if you're feeling suicidal as a result of this, there are hotlines you can call, text lines, chat lines. Please look them up and get the help that you need. So what does it feel to have bipolar 1 disorder? There's a number of things you're going to experience, and they're going to depend on whether you're in a depressive episode or a manic episode or hypomanic episode. So I'll go through them. In the body, in a depressive state, you're going to feel insomnia or hypersomnia, fatigue, change in weight or appetite, anxiety symptoms, aches and pains. If you're in a manic state, then you're going to have increased energy. You may be fidgety, you may feel less need for sleep, and you may feel an increased sex drive. When it comes to your thoughts and what's going on in your head, during a depressive state, you're going to have trouble thinking or concentrating, trouble making decisions, difficulty recalling things, thoughts of death, suicidal ideation, inappropriate self-blame. During a manic state, you're going to have racing thoughts and ideas, be easily distracted, and you may deny that you need treatment. Emotionally, during a depressive state, you're going to have intense sadness, anhedonia, alexithymia, melancholy, irritability in children, for example, or anger, guilt, low self-esteem and self-worth, hopelessness. In a manic state emotionally, you're going to have high self-esteem, have grandiosity, grandiose delusions. You may be cheerful, you may feel like you're high or on top of the world. There may be some irritability, and you may become hostile when you're challenged or when somebody tries to point out that you're in a manic episode. And finally, behaviorally, what may happen is in a depressive episode, you're going to have outbursts. You may withdraw socially, you may neglect pleasurable activities. You may have less interest in and desire in sex, trouble sitting still, picking at things, slowed speech and reactions, poor performance in school at work, and you may prepare for or attempt suicide. And during a manic episode, you may feel a need to talk. You may start conversations with strangers. You may speak loudly, dramatically, switch topics rapidly, and refuse interruption. You may have a lot of activity aimed at achieving goals, for example, starting a lot of new projects. You may feel very creative. You may have more engagement in activities that will result in pain, such as spending sprees, poor investments, and sexual promiscuity. That is a mouthful, and it is bipolar 1 disorder. If you have an experience with it, I'd love to hear it, so please share in the comments below. I thank you for taking the time to learn about it with me today, and I hope I've presented a nice, well-rounded human perspective on it. Thank you. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. However it is that you're feeling, whatever it is that you're going through, it's okay, and you are loved. Thanks again for watching.